The principles of prioritizing patient needs are grounded in several models of care. The hierarchy of human needs is proposed by which of the following theorists? A. Jean Piaget. B. Sigmund Freud. C. Abraham Maslow. D. Halbert Dunn. Answer: C. Abraham Maslow. In reviewing Maslow's hierarchy of needs, the client's needs are divided into different levels or hierarchy, namely A. Assessment, diagnosis, planning, implementation, and evaluation. B. Physical, mental, social, spiritual. C. Airway, breathing, circulation, nutrition, elimination. D. Physiologic needs, safety and security, love and belongingness, self-esteem, and self-actualization. Answer: D. Physiologic needs, safety and security, love and belongingness, self-esteem, and self-actualization. When responding to a client on the intercom, which of the following is the most appropriate response as a professional? A. Ask the client, kindly state your name. B. Say, what do you want? C. Give your name and position and say, may I help you? D. Say, please wait, the nurse will answer your call. Answer: C. Give your name and position and say, may I help you? Mr. Green is a newly admitted client in your unit. Which of the following things should you do to familiarize a new client with his environment? A. Tell Mr. Green to refrain from operating the TV and other personal gadgets in the room. B. Show Mr. Green where the call light is and how it works. C. Ask the visitors to leave the room until after admitting and orienting the client. D. Raise the side rails of the bed and raise the bed to a high position. Answer: B. Show Mr. Green where the call light is and how it works. Maintaining a safe environment is part of the functions of a CNA. When arranging a client's room, you should do all of the following except A. Administer medications as ordered on time. B. Check signal cords. C. Adjust the back and knee rests as directed. D. Check lighting. Answer: A. Administer medications as ordered. It is important to practice standard precautions when A. Providing oral hygiene. B. Dressing a client. C. Feeding a client. D. Ambulating a client. Answer: A. Providing oral hygiene. Mr. Harrington is scheduled for a cleansing enema this morning. What position should a client be in to receive an enema? A. Semifowlers. B. Lithotomy. C. Left sims. D. Prone. Answer: C. Left sims. Rapid heart rate, rapid breathing, and dry mouth are examples of which of the following categories of signs and symptoms of stress? A. Physical. B. Emotional. C. Cognitive. D. Affective. Answer: A. Physical. Those methods of disease treatment or prevention that are outside conventional practices are called A. Castigo de Dios. B. Yin and Yang. C. Shaman. D. Folk medicine. Answer: D. Folk medicine. From the following, choose the phrases that is / are true regarding the way in which an individual demonstrates pride in one's ethnicity. A. Placing value on specific physical characteristics. B. Giving one's children ethnic names. C. Wearing special items of clothing. D. All of the above are true statements. Answer: D. All of the above are true statements. When developing a therapeutic relationship, a desired outcome is A. Developing a friendship. B. Making the client comfortable. C. Moving toward restoring health. D. Learning to know oneself. Answer: C. Moving toward restoring health. An example of verbal communication is A. Moaning. B. Laughing. C. Writing. D. Crying. Answer: C. Writing. An example of nonverbal communication is A. Speaking. B. Moaning. C. Reading. D. Writing. Answer: B. Moaning. An obstacle to effective communication would be A. Using the principles of touch by giving the client a back rub. B. Accepting what the client says while being alert to what he or she is not saying. C. Asking the client if he or she feels lonely or sad. D. Interrupting the client when he or she seems to be deep in thought. Answer: D. Interrupting the client when he or she seems to be deep in thought. When the nurse assistant stops in during the evening, Mrs. D states that she is very worried about her operation tomorrow. Of the following responses, which would be the most appropriate? A. That is very understandable, Mrs. D. Would you like to talk about your operation? B. Don't worry, everything is going to be okay. C. That's just a routine operation that you are having. No need to worry about it. D. You'll be okay, your doctor and our operating room staff do these procedures every day. Answer: A. That is very understandable, Mrs. D. Would you like to talk about your operation? It is suggested that the nurse sit in a relaxed position at eye level with the client when communicating with him or her because A. This indicates that the nurse is fully involved in what is being communicated. B. If the client feels rushed, he or she may interpret this to be disinterest by the nurse. C. Responses to stress are manifested through active listening on the part of the nurse. D. People have less control over nonverbal communication than they do over verbal communication. Answer: A. This indicates that the nurse is fully involved in what is being communicated. For the visually impaired client, it is easier to read. A. Large print in black ink on white paper. B. Small print in black ink on white paper. C. Large print in blue ink on off-white glossy paper. D. Small print in blue ink on off-white glossy paper. Answer: A. Large print in black ink on white paper. For the hearing impaired client, the nurse can facilitate communication by A. Talking louder, using simple words, and lowering voice pitch. B. Sitting or standing beside the client's bad ear when talking. C. Selecting words that do not begin with the letters F, S, or K. D. Raising the voice pitch, talking softly, and repeating the words. Answer: C. Selecting words that do not begin with the letters F, S, or K. Entries on the client's record should be objective, accurate, and legible because A. The client records are used by all health personnel in the health agency. B. The client's records are the property of the health agency and must be kept neat. C. The client has a right to read his or her chart, therefore, it must be legible and accurate. D. The client records are admissible as evidence in courts of law. Answer: D. The client records are admissible as evidence in courts of law. Of the following individuals, which one is most likely to have a higher than average temperature? A. The person experiencing apathy and depression. B. The person experiencing an average day. C. The person experiencing anxiety and nervousness. D. The person routinely working the night shift. Answer: C. The person experiencing anxiety and nervousness. The condition in which a person is aware of his or her own heart contraction without having to feel the pulse is called A. Arrhythmia. B. Pulse rhythm. C. Dysrhythmia. D. Palpitation. Answer: D. Palpitation. The total amount of water that most adults consume each day is A. 1200 to 1500 ml/day. B. 1500 to 2500 ml/day. C. 1000 to 2000 ml/day. D. 2000 to 3000 ml/day. Answer: A. 1200 to 1500 ml/day. The oral hygiene practice recommended to break up bacteria lodged between the teeth is A. Using dental floss between the teeth. B. Directing a jet spray between the teeth. C. Rinsing the mouth vigorously with a mouthwash. D. Using an electric toothbrush regularly. Answer: A. Using dental floss between the teeth. The term partial bath refers to A. Washing the area around the client's genitals and rectum only. B. Washing in a manner to remove secretions and excretions from less soiled to more soiled areas. C. Washing areas of the body that are subject to the greatest soiling or odor. D. Washing all areas of the body at the sink in the client's room. Answer: C. Washing areas of the body that are subject to the greatest soiling or odor. The first measure the nurse assistant must carry out when a fire occurs is A. Notifying the switchboard using the proper code. B. Turning off the oxygen supply near the fire. C. Using the appropriate fire extinguisher. D. Evacuating the people from the room with the fire. Answer: D. Evacuating the people from the room with the fire.